Sickle cell disease is an inherited blood disorder which affects the protein called hemoglobin, the protein that makes our blood look red, which has the function to carry oxygen to the tissues. In sickle cell disease, because of a mutation in that protein, the hemoglobin forms a gel when oxygen is starved in the tissues. And when it forms the gel, the red cell, which should be in a donut shape to be able to flow freely through the small blood vessels, assumes a sickle shape, hence the name sickle cell disease. Now, this sickle shape is significant because it makes the red cells sticky to the blood vessels, which inhibits their flow through the blood vessels. In small blood vessels, in the course of time, this will be enough to block the small blood vessels and starve the tissues of oxygen. This results in acute bone pain, which is the hallmark of this disease, excruciating pain because the bone is starved of oxygen. In addition to small vessel damage, these cells damage the smooth lining of large vessels. And in the course of time, the muscle in the wall of the blood vessels thickens. And as it thickens, it narrows the lumen of the blood vessels and ultimately could cause a complete blockage of the blood vessels. And this is what may lead to stroke, that is, a blockage of blood supply to the brain. But it can affect virtually every organ, the lungs, the heart, the kidney, and virtually every organ in the body that needs blood supply. Dave, nice to see you. Knowing that you're living with sickle cell disease, how are you coping with learning at school?
Well, my teachers know that I have sickle cell, so they do several things to help me with it. They know that I need water with me at all times, and they know that I have to use the bathroom a lot.
So for some students who have sickle cell disease, they have some trouble with thinking and learning and remembering, and that's because of the way that the disease affects their brain and their thinking skills. Do you have any trouble like that?
Yeah, I forget a lot of things sometimes, and because of that, my teachers, they give me reminders by giving me the work that they did. And for instance, for math, I get extra help on that. And whenever I'm away, my friends, they come to my house and bring me homework. And one time when I was in the hospital, all of my friends, they wrote a card saying that they miss me and they want me to come back.
Students with sickle cell should be also given consideration about having their water bottle in class, and they should be able to go to the bathroom frequently. If they run out of having a drink, they will probably get into a crisis. So we advocate for them to have supplies in the schools for them to get their drink. And we're available to help all schools, and we'll be able to provide any information for teachers and students within the school.
Students with sickle cell disease are faced with a number of psychosocial stressors. These stressors can also trigger sickle cell pain, and a social worker can support them in various ways. I am available. I work at UHN in the Comprehensive Treatment Program for patients with sickle cell disease. It is called Red Blood Cell Disorders Program. You can reach out to me, especially for students who are adults or the older, the more mature students.
The WHO, which is the World Health Organization, and the United Nations have recognized the major burden that sickle cell disease poses in the world. We believe that about 1,000 babies are born every day in the world with sickle cell disease. Unfortunately, in low-income countries, many of these patients will die before the age of 5. The United Nations declared, therefore, that the world needs to pay attention to this disease, and therefore declared that June 19th every year around the world should be celebrated as World Sickle Cell Anemia Day, an opportunity to raise awareness about this disease, to create more partnerships between all stakeholders who need to come together to tackle this disease. So we look forward to June 19th this year, when we can all partner together to raise awareness about this disease, and in so doing galvanize support and partnerships that are needed to tackle this disease. With all of you joining together, we think we can make significant progress and make the lives of patients with sickle cell disease much, much better.
In collaboration with the Hospital for Sick Kids and the University Health Network, Sickle Cell Awareness Group of Ontario, Sickle, will provide support, informational resources, forums, seminars, in-school presentations, and other support mechanisms for educators and social workers in the school system. For more information, please visit www.sicklecellanemia.ca and by email education@sicklecellanemia.ca.